All right, so kind of wrapping it up here. Ultimately, kind of the overlying theme of this, I think, is that the greatest way that we can participate in advocacy of health promotion and disease prevention is to begin educating people early on, as those are the times that we can really instill healthy life habits, practices that will have a lifelong impact on them and their overall health. So, going forward, if you guys as physical education teachers or health education teachers can instill in your young students the importance of being active and eating a healthy diet, we can in turn decrease childhood obesity and diabetes. These things, when seen in childhood, greatly increase their risk for them continuing on into adulthood and causing a lot of other subsequent health issues that we know are related to these disease processes. So teaching them to have a desire to maintain a healthy lifestyle and dietary habits is absolutely a form of advocacy and health promotion and disease prevention. If as a physical therapist, you're able to teach your patients safe and effective routines and activities that they can do on their own at home to stay active, then you can reduce things such as obesity and heart disease that plague our society. My company recently joined, we made an agreement or contract with a local group of schools for us to exclusively provide them with timely care for their sports-related injuries of their student athletes. So this alliance was created and advocated for specifically by the group of athletic trainers that work in those schools who felt that their student athletes would benefit from having readily available healthcare providers without having to rely exclusively on the emergency rooms, which is often a lot more busy, expensive, and it's going to land them with a really long wait than as opposed to like an urgent care. This to me was a really cool form of advocacy to see have happen for a vulnerable population who, in times of injuries related to their participation in sports, could land them in an ER setting waiting for hours with a broken leg or a broken arm or a concussion and a really hefty ER bill. The trainers in that group saw an opportunity and provided advocacy on their behalf, and I'm really impressed and glad that I get to be a part of that in some way. So if we're willing to share our knowledge with others in order to both educate them and encourage them to have active participation in their own health journey, then the impacts that can be seen will be immense. We each need to be active participants in our own health and wellness, but to share that with others is a really amazing opportunity that I encourage each of you to participate in your own ways. Whether it's teaching a student about healthy eating or volunteering with community outreach groups with vulnerable homeless populations, or even participating in the political arena, lobbying for new legislation that can help protect the rights and voices of these populations. Whatever way you find it works for you, the ways in which you can apply advocacy are endless. So I encourage you to do so. I think it's one thing that you'll not ever regret doing. I hope that you'll find those ways going forward and that each of you has success in your semester going forward and the various careers that you're going into. If any of you have any questions about anything I've talked about or anything else, please feel free to let Professor McCown know, and I would be more than happy to talk to any of you about anything else or any of the questions you might have. Best of luck to you guys.